When we are going to look about one by one characteristics which is present with the research, so are representing the responsible and research needed to be ethical, that represent by E, and S for science, that is, and also we are work with the evidences, so that's represented by E, and A and or above, because always we needed to be responsible, ethical, and needed to be work with the science, and also that needed to be evidence based as well, are representing reproducible, and C for the challenging, and H for the honest. What does research tell us? Research can tell us many things about people, society, health, and behavior. It can tell us about thoughts and opinions, as well as norms, habits, culture, scientific facts, attitudes, medical information, so on. In nursing, it is highly useful. For an example, if we study patients' attitudes toward insulin therapy, we can understand why some people delay starting insulin. If we study cultural practices among postpartum mothers, we can understand how culture influences maternal and neonatal care. As well, research does not only give numbers, it can also explain beliefs, feelings, experiences, and behaviors. So, you can see that the key dimensions of research design decisions. So, we needed to be have a topic, and also we needed to be create a new or review published data or informations, and also we needed to be go ahead with the new technologies, as well as we have to go with a study a single case as a sample, and also we needed to be much more observable, and also there are different kind of methodologies, qualitative and quantitative, and also in the ideologically the objective versus subjective is in there, and also there are some policies. So altogether, reassembling the dimensions is important when we are go ahead with the research. What do we do with research? Research should not remain only as an interesting fact. The most important thing is to use research findings. Research can be used to make decisions, perceive and influence others, create change, change behaviors, improve practices, use resources more effectively. So, for an example, if research shows that many mothers have poor knowledge about the oral rehydration solution preparation, nurses can develop health education program. If research shows that nursing students have poor confidence in clinical skills, educators can introduce simulation based training. Therefore, research is useful only when it is applied to real practice. So, when we are look about the knowledge, interpretation, and dissemination, first is knowledge generation. Research helps us to produce new knowledge. For an example, research may identify that first year nursing students experience high anxiety during first clinical placements. In the second, interpretation. The data must be interpreted carefully. For an example, once we are conducted the previously I mentioned research, so we found that if 75% of students report anxiety, we must explain what that means and why it may be happen. The third is dissemination. The research findings must be shared with others. The findings can be shared through the reports, journal articles, conferences, seminars, or medias. If research does not disseminate it, others cannot benefit from it. So you can see that the characteristics of the good research. So that needed to be a systematic one, and also that needed to be uh, independent, open to criticism, and also that needed to be non-discriminatory. So what are the benefits of doing research? So once we are going to do a research, so there are so much of benefits that we can have. Especially, we can develop the ability to apply the research methodologies to solve the real world problems. So, up to now, with the time to time, I explained that how we can resolve the problems. Once we are working as a nurses, once we are identifying that there is somewhat of a gaps in between our patients or our healthcare systems, knowledge, practice, and attitudes, so then we can work with the research and it will be a benefited thing to conducting the research. As well, we can foster the teamwork and build the professional relationships. As well as it's too much important to develop the communication skills, and also it's enhancing the leadership and also the organizational abilities, as well as it's integrate the knowledge across multiple disciplines, and it's improve the career opportunities, and also that's presenting the readiness for the advanced studies. Okay, now we are moved to talk about the scientific research. So up to now, we are gain a lot of details which is regarding what do you mean by the research. Okay, so I think now you are much familiar about the term research and what are the benefits of research and what are the main contents which is included with the research. So, how that scientific research which is differ from a research, and what are the main things that we needed to be focused? The scientific research is different from ordinary searching because it follows scientific principles. It is systematic, evidence based, logical, and critical. Scientific research does not depend on personal beliefs, assumptions, or gestures. It depends on observations, measurements, reasoning, and also the experimentation. In nursing, scientific research helps us to identify which interventions are effective. What is science? Science is a systematic way of building knowledge. Science explains and predicts things using testable ideas. This means scientific ideas must be possible to test. Science is based on evidence from observations and experience. It follows organized methods and principles. Science is not only a body of knowledge, it is also a process of inquiry. This means science beings with questions and seeks answers through evidence. How that we can define the scientific research? Scientific research is a systematic, empirical, and critical process used to investigate relationships between phenomena and produce evidence based knowledge. Let's break down the definition. Systematic means it follows clear steps. Empirical means it is based on observation or experience. Critical means evidence is carefully evaluated. Phenomena means events, situations, behaviors, or experience that we study. For an example, the relationship between nurse workload and medication errors is a phenomena that can be studied scientifically. If we collect data about workload and medication errors, analyze the relationship, and interpret findings carefully, that becomes scientific research. So, the scientific research is a research, but not all research is scientific. You can see that there is overlap, but all the research that we are not considering as the scientific research. With the previous slide, I explained that what are the main features that needed to be present with the scientific research. With that way, you can categorize what are the scientific researchers and also what are the non-scientific research. Okay, up to now, we are completed main two concepts that we plan to cover in today. Those are scientific research and also the research. For the board, now you are having the proper understanding about that, how that we can go ahead with the appropriate awareness about the research and the scientific research to conduct the nursing research.